So lately we've been talking about the different importance of different diagnosis or modalities, that's imaging modalities, right? And here we'll be looking at what is known as what radionuclide imaging. Radionuclide imaging. All right. So for the radionuclide imaging, its importances include the following. So we're saying that radionuclide imaging is useful in many situations. And some of these situations include what? Diagnosis of stress fractures or other undisplaced fractures that are not dictatable on plain X-rays. So you employ this if plain X-ray is not giving you what you want. Okay. It can also be used for dictation of a small bone abscess or an osteoid osteoma. Also investigation of loosening or infections around prosthesis. Alright, that's basically all those implanted stuffs, right? Implant some stuff, then they're having some infections around them. You want to dictate. Also, diagnosis of femoral head ischemia, Impart's disease or avascular necrosis in adults, and also early dictation of bone metastasis. Okay. So scintigraphic appearances in these conditions are described in relevant chapters as we move and make more videos on this. So in some cases, the isotopes can serve chiefly to pinpoint the site of abnormality and should always be viewed in conjunction with other modes of imaging, right? So bone scintigraphy was relatively sensitive but non-specific. So one advantage is that the whole body can be imaged to look for multiple sites of pathology, just like here having a whole body image for that, right? So you are checking for occult metastases, multifocal infections, multiple occult fractures, right? So it is also one of the only techniques to give information about physiological activities in the tissue being examined, okay? So however, the technique carries a significant radiation burden, all right? In radionuclide imaging, there's a lot of radiation burden, right? So the image, okay, and the radiation burden is approximately equivalent to about 200 chest x-rays. That's crazy. And the images yielded make anatomical localization difficult. Okay, so for localization problems, MRI has superseded bone scintigraphy as it yields what much greater specificity or much more better images than this type of imaging. Okay, so I think that's it for the clinical applications of radionuclide imaging, although it's not commonly used now, but we'll always discuss, okay, things in the medical world, whether they are used or not.